sleep, is defined as a periodic phenomenon of more or less complete suspension of consciousness and will, during which the organism recovers energy. It is possible to be mentally awake while the body remains asleep, paralyzed. You can't move or talk. The heart starts beating fast and the breathing becomes agitated. Levels of anxiety, panic, and fear increase, which trigger hallucinatory phenomena, blurring the boundaries between reality and illusion. You may see a dark presence in your room, or hear whispers, or more rarely voices. You are imprisoned within your own body. You try to ask for help, but nobody hears you. Your voice is drowned out by something abnormal. This is what is known as sleep paralysis, a frightening experience, characterized by the inability to move, shortly after falling asleep, or upon awakening. It is one of the sleep disorders, in which we are aware that we are awake, but the muscles no longer respond to our control. In the past, sleep paralysis was associated with evidence of demonic intervention in human affairs, or the negative influences of witches. In the Japanese tradition, sleep paralysis is caused by a vengeful spirit that suffocates its enemies. Types. We know that during falling asleep, there is a transient loss of consciousness, accompanied by the alternation of two phases, REM phase and non-REM phase, which follow each other in at least 4/5 cycles per night. Under normal conditions, during the REM sleep phase, we all experience, without being aware of it, a completely natural muscle paralysis, which ends when we wake up. It is a mechanism that allows us to protect ourselves from the involuntary movements caused by the dreams we have. Sometimes, this mechanism can malfunction and cause sleep paralysis or sleepwalking. Awakening occurs before the brain takes control of the muscles again. Sleep paralysis can be classified into two types, depending on when it occurs. If it occurs when you fall asleep, it is called hypnagogic paralysis, while if it occurs upon awakening, it is called hypnopompic paralysis. Symptoms. Sleep paralysis can manifest itself with different types of hallucinations. You may feel the presence of a stranger in the room, which doesn't have to be human. They can also be ghosts, demons, or aliens. They can stare at you in a creepy way, but also get closer and closer until they touch you. You may feel pressure on your chest, as if someone is squeezing your ribcage, holding their hands on your neck until you choke. Another type of hallucination is the sensation of leavening, i.e., you feel as if you are leaving your body, as in the case of out-of-body experiences. The phenomenon can manifest itself with different symptoms and levels of intensity from person to person. Some of these are inability to move or speak. One is therefore conscious but without any reactive capacity. The event can last from a few seconds to a few minutes. Visual auditory hallucinations. Sensation of floating outside one's body. Numbness or tingling, which runs through the body to the head. Causes. We have said that the cause is an alteration of the normal cycles that occur during sleep. There could be an alteration of those neurotransmitters responsible for the paralysis of muscle relaxation, which occur at the wrong time of sleep. Some studies have been conducted on the causes of sleep paralysis. However, it remains a very difficult condition to explain, even if today, we know more about the chemical processes involved during a sleep paralysis. There are two brain chemicals involved in the disorder, namely glycine and GABA. It increases the activity of the neurotransmitter GABA in a portion of the brainstem, which inhibits the cells of the nuclei of the dorsal column, thus reducing the response to sensory stimuli, and therefore preventing us from making movements during a dream. However, if the brain continues to produce glycine and GABA, even though we are awake, it is at this point that sleep paralysis occurs. Some factors that appear to be involved in the onset of sleep paralysis are specific personality characteristics. Other sleep disorders, such as insomnia, are long periods of sleep deprivation. Post-traumatic stress disorder or other psychiatric disorders. Long and intense periods of stress or an abuse of exciting substances, such as caffeine, but also of drugs, nicotine, and alcohol. There may also be a genetic component in the development of the disorder, as a high association has been observed in monozygotic twins. Treatment. To avoid episodes of sleep paralysis, it is recommended to improve the sleep cycle, sleeping at least 6/8 of an hour a day. Falling asleep and waking up at about the same time are good habits. Reduce stress and practice meditation. Avoid exercising in the hours before going to bed. Treat other disorders that can cause sleep paralysis. Hallucinations are more common when we sleep belly up. In case the disorder is chronic, an antidepressant treatment can be used, but it must always be prescribed by the doctor. These are medicines that help reduce the intensity of muscle relaxation at night, and also the depth of sleep. Cognitive behavioral therapy also often helps the subject to become aware of the benign and temporary nature of the episode. If, on the other hand, fear, anxiety, and anguish continue to increase, a negative loop is generated that will only aggravate the episodes and hallucinations. Sufferers must understand that this is not a paranormal event, and that they are not crazy.